Hey there, Dr. Scott Shella here with you again for the Research for All of Us webcast. And today's story I've got for you, the research paper, is a great one about a little 2-week-old boy that was having a couple of different problems and got some great relief from a chiropractor. So a really exciting story. So yeah, we had a 2-week-old little boy. Was born fairly normal, but when he was born, he was having trouble nursing and latching to nurse. And what they had found was when the pediatrician did an exam after he was born that there was a change to the attachment of his tongue. So instead of his tongue being able to lift off the bottom of his mouth, it was the attachment all the way to the tip of his tongue, so he couldn't lift it properly. And that was where they felt the problems were coming from with the nursing and being able to latch. So their recommended treatment was they would just surgically go in and cut the attachment to the tongue and sever it so that it could then move and lift properly. The mom wasn't real happy with that answer. She didn't really want her 2-week-old undergoing surgery, so she sought out some alternative methods. She first went to a chiropractor and wanted to see if they could do anything for him. So chiropractor did his exam on the little boy, and as all chiropractors do, he was not treating the tongue, he was treating the infant's spine. That's what we do as chiropractors. We focus on the spine to address problems that could be happening elsewhere in the body. And when he did evaluate this little boy's spine, he found he had some subluxations or misalignments in the bones in his spine, in his upper neck, so the very top bone in his neck where it articulates or moves with the skull, and then in his mid-back or in his rib cage, and then also down in his lower back. And he also noticed when he looked at him that he had difficulty turning his head to one side. He could turn one way easily, but the other way it was kind of restricted, and you could see he was uncomfortable rotating his head to that side. So chiropractor laid out a plan of care, involved some chiropractic adjustments. And let me warn you right now, if you've ever been to a chiropractor, if you've been adjusted and have never seen an infant or a child get adjusted, it looks nothing like an adult's adjustment does. There's no quick movements. It's very light, very gentle, just slow, sustained pressure. If you're watching, oftentimes it doesn't even look like anything was done because it's just a very light corrective force in the direction that the bone needs to be adjusted, and that's it, very light force. So nothing like it looks on an adult. But anyway, so he started adjusting this child's subluxations or misalignments in his spine, and after just 2-3 visits, the mother noted when she came in that he was nursing better, he was not having as much difficulty latching, and was already improving. Then by about 10 visits in, he had was completely normal, having no more issues was nursing completely normal, and they actually noticed throughout the course of care that the attachment to his tongue physically changed and now had normal full range of motion, and the attachment had changed as he developed normally to be able to latch and nurse fine. So I know what you're thinking. How does touching a baby's spine have anything to do with their tongue? Well, in this case, I think there's a couple different things happening with this little boy. So the initial first couple of visits that caused a change in him being able to nurse, I think just strictly came from being able to move properly. Once his spine was freed up and adjusted and not locked up and interfering with his motions, he was able to turn his head and rotate easier, and that made it easier for him to nurse. And then as we went on, there was a physical change to his tongue in the way the attachment was formed under his tongue. This baby had appointments with a oral specialist to prescribe the surgical procedure, and when they went for the follow-up after the chiropractic treatments and he was nursing normal, the pediatric oral specialist said, nope, he's fine, no need to do any further treatments or surgeries or anything, and totally released him from care. So what I think was happening in the latter part of care is it just shows the power of the chiropractic adjustment and of allowing your body to work and heal the way it's supposed to. That's what a chiropractic adjustment does. It's just aligning the bones, freeing up any restrictions in there, any of those subluxations we talk about, and allowing the free flow of energy from our brain through the spinal cord and then out through the nerves to whatever they go to and control. And as the body's developing and growing, if it can do so without any restricted nerve impulse, then it should develop and grow fine, and that's exactly what happened in this little boy. So he's nursing great, those problems all went away, but he had another issue. So they had also noticed when he was born that his head was misshapen, so it wasn't real round and smooth. He had flat spots, and sticking out on one side. And this is a fairly common occurrence in kids in any type of birth, but especially if there was any kind of extraction devices used. So things like a forceps or a vacuum extraction. And if you haven't seen or experienced that, it's exactly what it sounds like. There's a vacuum that they stick to the top of the baby's head and then pull to help extract them, to get them out if it's a kind of difficult birth or there's any challenges there. So you can imagine doing that. Suction of the head is really going to change the shape of the skull. So we need to start with what happens when a baby's born, even under normal circumstances. So if we look at our skull, right, if you look close on the top and on the sides, there are these, they're called sutures. They're lines between the bones. So the skull isn't one solid bone. It's actually several different plates or bones that make it up. And when we're first born and growing and young, these sutures are not fused. They're actually separated. That's where the soft spot comes from. It's the joining of these three skull bones right here. It's the space between those. So what happens normally during birth, as the baby's being born, those skull plates actually push together and even overlap to make the physical size of the skull smaller to aid in the birthing process. And then after the baby's born, those bones should separate, realign themselves back where they're supposed to be. But that doesn't always happen. Sometimes instead of setting where they're supposed to, they may still be overlapped. They may misalign as they try and reset. And that's what causes that abnormal shape to the skull. As I said, it's much more common with extraction devices. You can imagine if suction cup is suction to it, it's going to pull and really misalign those bones as the baby's being born. So normal medical treatment for that is they would put the child in a helmet. It kind of looks like a bicycle helmet. It's a hard plastic, and it's got pads in it to hold the bones in place so they shift back to where they're supposed to be as the child's head grows and expands. And this child had an appointment with a pediatric neurologist, and that's exactly what they were recommending. They had about 2 weeks' time if they were going to have that appointment to put him in the helmet. So the mom brought this issue up with the chiropractor and wanted to see if there's anything he could help with that, since she had such great results with the nursing issues. So the chiropractor looked at him and started to adjust his cranial bones. Just like we can adjust the spine, we can adjust those bones. And the same thing, it's just very light pressure on those suture lines, trying to realign the skull bones, get them moving properly so they can set back where they're supposed to be. So at this time, since the nursing issue was resolved, the kid was coming in a lot less frequently, but now they had just a 2-week window before this appointment was made for the helmet to be put on. So ramped up the visit frequency a little bit, seeing him a few times a week, working on specifically those skull bones, in addition to checking his spine each time he's in. And after about half a dozen visits, the skull was looking a lot better, much more normal in shape. Still had one flat spot in the frontal bone right in the front here, so they continued to work on it. And then that one cleared up also, and the skull had a nice normal round shape. Had the follow-up appointment with the pediatric neurologist. Same story as with the nursing issue. He said, nope, skull looks great, kid's fine, no helmet, and he was free and clear. So I really like this story, this research paper, because it shows just how important and how widespread and beneficial chiropractic can be for all sorts of things. Yeah, we're known as neck pain, back pain. Doctors, we take care of those things like nobody's business. But what chiropractic is really about is freeing up that energy to flow through your nervous system so your body can function and heal properly, using that innate inborn intelligence that's inside all of us to heal and correct things on its own. And that's exactly what happened with this little boy. Once the nervous system could function properly, then he developed normally and properly, just like he was supposed to. He wasn't coming in with neck pain, back pain. He was 2 weeks old. He's not going to be complaining about his sciatic and my hip, right? He's too little. So again, just really shows the power of that. So a great story. Hope you enjoyed it. Hope you get something out of it. Please share with anybody you know that would benefit from this information. That's why I'm here. That's why I'm doing these, to spread the word and just help as many people as we can as chiropractors. So if you liked it, be sure to subscribe to the YouTube channel. There'll be a lot more of these videos coming up on not just chiropractic research, but all kinds of research articles. Follow us on Facebook. All the usual social media channels. You can find us, and there'll be plenty more to come. So with that said, have a great day, and thanks for watching.